to share the presentation today. So I am a healthcare advocate. I have a background in healthcare for well over 16 years, and I have been able over the last few years to develop a model to help nurses and the medical professionals to really improve the quality of care delivery. And all of us at some point, we're either patients or, if you're into healthcare, then you're at the bedside, you're a clinician, you're a provider, right? So my model is about using non-traditional models of care to improve staff and patient outcomes. It's Melhedia's integrated model of nursing care, MIMO NC 2021. All right. So some of the main reasons behind this model or the motivation is due to 21st century global healthcare challenges like every health facility is faced with increasing patient care safety issues. So it doesn't matter the country that you're in, even in first world countries like the USA, Canada, the UK, countries in the global south, obviously, countries in the Caribbean, they have and they experience increasing patient safety issues. Yes. So we find patient safety issues. I wanted to create a model that could respond to, these concerns that we're having. And another main 21st century challenge for us as global healthcare individuals, low staff morale, because especially during the COVID-19 pandemic, health systems were overwhelmed, health systems were inundated, right? So low staff morale, high staff burnout. Again, in every country globally, these are critical issues that need addressing. And we also find that because of the burnout, because of the increase in patient safety issues, because of increased litigation, then the staff, the healthcare staff, were constantly quitting and leaving the workforce and going into other professions, doing other things because the health system just really got to them. So this model takes an innovative approach to deliver high quality nursing care, and it really puts forward some practical solutions. So again, why MIMO NC? Due to increased patient safety issues like falls, medication errors, healthcare worker burnout, low staff morale and satisfaction, and we've even had incidences of healthcare workers committing suicide. Yeah. And we have, as I mentioned, the brain drain and skills drain, because whenever you have, your healthcare workers, your doctors, your nurses, your pharmacists, uh, leaving, quitting their job locally, in countries like Nigeria, a lot of health professionals are migrating to the West, coming to the USA, Canada, coming to the Caribbean countries. Then you have brain and skills drain in the workforce in those developing countries. And obviously, their people, your people in your country also need healthcare. So then, all your qualified professionals have left you for whatever reason, maybe for better economic opportunities, and gone to, greener pastures, but that consequently results in like brain and skills drain for your developing country. Your workforce is gone. So again, MIMO is a non-traditional model of care that demonstrates how senior staff can mentor new nurses to develop confidence and competency. The model integrates Benner's novice to expert theory, Goldman's emotional intelligence theory, and the team approach to improve patient safety, staff satisfaction, and staff retention. So, this is it. Benner's novice to expert theory, the team approach, and Goldman's emotional intelligence. Those are the three main facets or components of the model. Now, Goldman tenets of emotional intelligence looks at self-awareness, looks at how staff can be more self-regulated, looks at also social awareness, and looks at social regulation. So with self-awareness, the model aims to look at how new nurses can develop, recognize their limitations as new nurses or new care professionals, and develop, say, confidence, know when to ask for help. And for self-regulation, just know how to really come into their own as experts and as seasoned professional. And social awareness, again, has to do with, for example, knowing and understanding the cultural norms. We spoke about cultural competency and language, overcoming language barriers, right? Whenever medical professionals leave, for example, one country and goes to another country, there's social things, social barriers that they have to overcome. So, the model really looks at using the emotional intelligence theory to overcome those challenges as healthcare professionals. And social regulation has to do with understanding the norms and organizational norms of whichever facility and country that they're going to practice in. Dr. Benner's nursing theory, again, takes us through a continuum from novice. Novice is like a new worker, new grad, just coming into the profession. And her theory is that individuals, they mature in their career along a continuum. So after some time, they'll become an advanced beginner, advanced clinician or practitioner. Then they become more competent and confident. Then they become proficient, and then they become an expert. And the thing that my model found while researching is that some nurses, for example, I could have been, when I migrated to the USA, I was practicing for well over like 10 years in my country, Jamaica. I was like an expert. I was a midwife, I was really autonomous. But then coming to a new country and practicing as an international nurse, I literally became a novice again. I had to start all over. I had to learn, their policies, their laws, their cultural norms, and their medications were different, everything. It was just so new. So literally the theory explores how even as a seasoned professional, one can have to start over again and go through this continuum, right? Then the team approach theory, that's another key component of the model. And it shows how collaborative care, shared roles and responsibilities increases workflow efficiency and staff satisfaction. So those three things, really, really make the module a unique and an ideal model for like several professions, not just professions that are into healthcare. Now, reasons for implementing MIMOS. So this is just a quick review of like a case study that we did with this model. Because this is TCU means transitional care unit. So it's kind of like a step down from an ICU, an intensive care unit, but it still has a lot of, very intense skills, knowledge, and things that are going on in that unit. And what we found is that there was rapid staff attrition. So, staff were just like burning through so quickly, nonetheless, because they felt overwhelmed. And there was an influx of, a lot of new grads, a lot of new nurses, and again, very, very high need patients. And, this was very, very demoralizing for staff. So our goal using the model was that, nurses would develop their skills and become experts. And we found that once we implemented the model, using like the team approach and, tying in the whole emotional intelligence and all of that, then the statistics improved. So after 3 months, 0 patients had an injury. Remember, that was some of the concerns. Medication errors, patient injury were on the increase. But using, the approach, then 0 patient fell. 10% staff satisfaction increase. Their, Pers Gini here in the US, Press Ganey is one of those, rating. First world countries are really big on like surveys and rating performance, that sort of thing. So here, the Press Ganey satisfaction was like number one. Everyone was like, wow, we love the team approach to really giving care. And we found that there was an 88% compliance rate in participation, because everybody on the team felt supported, felt safe to practice and to give quality care. So these are some of the results. Pre-implementation, 61% of staff, they didn't feel supported during their shift, and 38%, didn't feel as great about peer accountability. But post after implementing, the team approach, then those statistics also improved. So we found that 72% of staff felt supported during their shift. Sorry. 58% felt good about, the fact that they had their peers also, keeping them accountable, helping them to practice and perform better. And 45% increase, that, the care, the quality of care and the continuity of care was absolutely improving and was better. So we see that Mimo, really, really allows and facilitates new staff to progress along the Benner continuum from, being a new person, just coming in, not really sure what to do, their hands shaking when they're given an injection, but then because they have that senior staff with them, they're able to give safer care and more confident care. And then they're able to progress to becoming proficient experts. So Mimo NC is able to improve patient safety through adequate orientation period, effective progression through the clinical continuum, developing self-confidence and self-awareness. These are the benefits and how Mimo helps young staff to really get more confident. It improves patient-centered care experience. It improves and promotes patient-centered nursing culture. It ensures physical and emotional safety, and it increases the staff morale and team spirit. And all of these factors will, over time, contribute to staff actually wanting to stay in the healthcare workforce, because, the results and the outcomes for everyone are better. So Mimo NC is an evidence-based solution to global healthcare challenges. It's based on strong theoretical foundation, which is Dr. Benner's novice to expert theory, Goldman's emotional intelligence theory, and the team approach to nursing. And the very practical outcomes, as we mentioned, is improved nursing practice, enhanced care quality, increased patient safety and satisfaction, boosted staff morale, and also, staff don't want to just leave their job. So remember yesterday when we were asking some of the challenges that people experienced in their jobs, like the nepotism and the bullying and the harassment and all of those great engagement that you gave feedback, right? So Mimo were also able, because of the integration of these theories and the comprehensive strategies for staff to develop their competency and confidence, their leadership development, the whole team nursing supporting approach, then patient outcomes are better, staff satisfaction is better, staff's retention is better. And the great thing about Mimo is that this model can actually be used by several other professions as well, and not just sorry, and not just the nursing or medical fields. So if you're a teacher, you should really be adopting a model similar to Mimo, because young teachers need that mentorship. And as a matter of fact, a lot of teachers, when they migrate as well, say from the Caribbean, going to the UK or a different country, coming to the US, they feel overwhelmed as well. They feel unsupported, yes, in their profession. So everyone can really benefit from mentorship models. And conclusion, so Mimo is a path forward to addressing some of the 21st century global health challenges. It's an evidence-based model. It integrates established theories. It addresses the contemporary medical and nursing related challenges. It improves patient and staff outcomes. Next steps. So I'm grateful I have been able to present my model at the International Conference of Nurses in Canada last July. I did go to Canada, Montreal, Canada, and I did this presentation. I've been presenting the model here across the United States, and it has been getting great feedback here in the USA and in the Caribbean. So if you are interested in really learning more about MIMO-NC and how it can be implemented in your facility, if you're into healthcare, then I am willing, I'm more than ready to partner with you to really, improving your mentorship and your system, you're strengthening your health systems, especially for your newer staff, so that they can feel safe practicing, they can feel confident practicing, and so that you won't be experiencing the high levels of low staff morale and then staff just saying, look, I quit my job, as a healthcare worker. I don't love my job anymore. I don't love what I'm doing and I don't want to do it anymore. So make sure these are my references. And yeah, let's have a conversation on just, making healthcare better for everyone. Thank you. All right, so you can go ahead and drop some love, likes, comments, feedback in the chat. Your takeaway from MIMO-NC. How do you feel like it can make your profession better? Yes, it does not apply just to nursing only, as I said. There's definitely room for other professions to adopt the MIMO-NC model. So, just go ahead and let's have a conversation too around how MIMO can help with solving some of the staffing issues, staff attrition issues that you might be having in your community. All right, Mohammed, let's see. Any of our presenters ready for this session? See, we still have we still have time. Is Bukhari ready now? Is Bukhari here? Bukhari. Yes. Comments? Any questions for me? Anyone? Mohammed Ishmael? Does anyone have any questions for me in the chat?
Yes, it's really amazing presentations about the MIMOS models that could especially help African nurse because you know that if you will be ill, so if you feel that the nurse is kindly, so you will be better because you know that there are many nurses that is how they dealing with, especially when they using syringe and if you and also dealing with regulars and especially when regular treatments that they are giving to patient and you know that in Africa there are many patients they are die because of lack of care, especially because maybe the nursing maybe they do not care about them or that the time, especially the times of shift when we have like we work 24 hours and then the team is working only 8 hours. So in the period of shift is happening more things. So we must develop our moral of our nurses. How can we deal if our time is go out and this we used to leave as hospitals because of our shift because I face many challenges in when I came or when I bring emergency cases. So when
Right.
we want to dealing with especially if you are brings them to in the time to have moral, they will leave you. So I really happy that you sharing these models, and I hope that this model is bring to Africa's nursing, special African hospitals.
Yeah,
So yeah,
I'm definitely open to partnering for sure.
yeah,
Yes. I really see that there is that need. I know a lot of the African nurses, they feel so overwhelmed too by the health system that is there, right? The needs are many. And a lot of times there was a discussion in the previous days too, where some of them were saying the compensation, that's how the Caribbean nurses feel as well, like we sorry, we're doing so much, and yet our governments, our countries aren't really paying us properly, compensating us. So because of this, we find that a lot of healthcare workers, nurses especially, are just migrating, yeah, leaving for greener pastures, literally going to the UK, going to Canada, coming to the USA, because they love their people, but then they have their families in Nigeria, in Ghana, in Zambia, in South Africa. They have their families who are depending on them, right? They want to go back too. Most of like my colleagues and my teachers were Nigerians when I was doing nursing in nursing school, and they would say, I have to go back to my village and develop, uh, build a hospital. And we were like really impressed, because they migrate, but their country is really still on their heart, because they want to go back to the villages so that they can give back and create the better health systems and better infrastructure for their people. They're coming to sacrifice and to work and to earn money, but to go back to the village and to build these health clinics, these hospitals, to help their people. So we definitely need to expand those conversations where the people are properly compensated, and those proper systems are in place, where they don't necessarily all the smart brain, that brain drain that we were talking about too. It's a part of collaborating and making sure that our health care systems are really resilient. Yes, so that's just great. Any questions in the chat?
so I have one question about is there any appearance or shape of nursing? Because maybe many patients that feel that if nursing is fat or it's looking is angry, maybe this is fearing. So I wonder about, so how can we minimize the look of nursing?
Wait, okay, how can we minimize the look of nursing? I didn't get the first part of the statement.
I mean that minimizing or by building their morals to change the mindsets of the patients, because maybe the patient that feel that if the nurse is fat or if the nurse is look furious, so they can afraid of her.
Oh, okay. Let me see if I heard you correctly. So you're asking if the nurse looks serious, like they're not friendly. Is that it?
Yeah, like this. Yeah, because
Well.
the kids are kidding. Maybe they fear from her.
Mhm.
But maybe
Oh,
she is kindly, but the look of her is maybe uh affecting the
threatening.
some person. Yeah.
Oh, okay, okay. All right. So, uh, well, let's see. All right. Well, if I am to answer that question, nurses, like any profession, doctors, pharmacists, radiologists, whatever it is in the healthcare field, or even teachers, teachers, lawyers, all professionals are supposed to maintain, some professional boundary, because at the same time, you have to be careful. Nursing is one of those hands-on professions where especially, if you're a female. I know in a lot of African societies, which I love, that in Africa, nursing is a male dominated profession. It's not necessarily just females, both females and males alike are, it's just a norm being a nurse. So that's great when we take away those gender biases out of professions, and everybody is able to earn more equitable pay, right? Yeah, and living. So I'm happy that the African countries, they've taken away that bias to say, okay, nursing is just more a female job. So with professional boundaries here in the Western Hemisphere, however, the Caribbean, nursing is predominantly females. And so if you just go into a hospital and, you have your male patients and then you don't establish certain professional boundaries, then those male clients are going to come onto you a lot. Yeah. You will get a lot of sexual harassment from your patients. So I know it's not that we don't want to be friendly with our patients, and we just want to come with a stiff face, like when we are giving care. We want to be pleasant, but we have to be very, very careful and make sure that professional boundaries, yes, are maintained. Or we encounter, especially female nurses, we encounter a lot of sexual harassment in our profession. Yeah, so I hope that question um answers your question. Anybody else? I need to partner with you. Yes, Matua. I'm open, a healthcare worker in refugee setting. Yes, all of these things. Thanks a lot. You're a good presenter. Really appreciate the way you speak. Thank you. Thank you, Hey babe, for that comment. Thank you so much. Thank you. Thank you very much. Very impactful Flora presentation. Thank you very much for the comments. How can we connect? Oh yes, connect with me. Afterwards, I'm open. I'm on LinkedIn. You can connect with me through the MIA Foundation for sure. Yes, most of us migrate from our country to another, right? Because, right, the economic concerns. Yes, absolutely. I totally understand that for sure. The economic concerns are great. Yes. All right. Wonderful. Any other like comments or feedback? Anyone? I love the engagement. The chat is blowing up. I just love how you're just all locked into the chat. Thank you. Thank you so much. Great, great. I'll drop my information in the chat later. All right, great, great. All right, so let us see. Let's see if we head again into our next session. Don't see Bukhari, but we do still have some time there. And then event 12 is coming up. It's going to be a dialogue. Event 12 is digital health tools for healthcare delivery. And Precious Ijiba is going to be our keynote presenter for that session. Yes, we have two keynote presenters for the next session. Matthews Mashanai out of Zambia, Precious Ijiba out of the United Kingdom, and Kim, the Vibe Master, Kim Albert out of Ghana, is going to be our moderator for the next session. But we still have some time. Thank you, Juliana. Great. Victoria, my namesake. Where are you from, Victoria? Great presentation. Thank you. Drop where you're from. Thank you. Juliet Ngozi, thank you very much. Awesome. Kim Albert, Mimo, and C to the world. Thank you. The comments are cracking me up. But thank you. Oh yeah. Saba, thank you so much for your humorous emojis. Jonathan, DJ Flo, Amelia, great. Love it. All right. Okay, Victoria said, "Oh, Ghana, yay! See, I represented Ghana yesterday. Lovely, Victoria from Ghana. All right, beautiful. Thank you so much for your engagement in the chat. Love it. Let's see if we have just checking Bukari. Any of our other presenters are here. As are on here as yet. Love it. Love the engagement, everyone. Just keep those emojis dropping. Yes, keep those emojis dropping. Let's see the love, the fire, the rockets. Let's see those emojis blazing up the chat. I love, yes, love Juliana. I love it, love it. Keep those emojis going. All right, we are going to get our next presenter on shortly. Thank you. Yaya, where are you from? Yaya? Yahaya? Yahaya. Or the Y, is it a J? Does it have a J pronunciation? Just let me know that. Is it Jahaya? Jahaya? Abdullaha? Abdullahi. Where are you from, Abdullahi? And tell me if your first name has a J pronunciation. Yes, Musa says, okay. No J, it's Y. Okay, so it's Yaha, Yaha, yeah. All right, thank you for that. Thank you for that. Great, wonderful. Thank you for that great engagement. Shout out to Abdullahi from Nigeria. I tell you, the Nigerians are making sure that they close out today's session in fine style. They're not going to be outdone today. Amelia Frederick, brilliant one. Great, great. Thank you for those comments. Yes, Musa says promoting more comprehensive and effective healthcare. Yes, yes, we need that because all of us, we're either users or providers of healthcare. So we have to make sure we, as young people, we have to advocate, ask our governments to continuously, they owe that to us to improve our health system. So we have to add our voice to that conversation and, make sure that they're also putting in these policies like here in the Western Hemisphere these countries are big on policies, and because for obvious reasons, if there's a medical error, like a wrong surgery, when there's drug error, medication error, then people's lives, sometimes the outcomes are fatal. Therefore, a lot of litigation, there are a lot of lawsuits, a lot of people sue the hospitals and sue like the state, millions of dollars, when their loved ones are injured or even die. Therefore, they make sure that they prioritize, they're big on policies, they're big on checklists here. They are big on like auditing the hospitals, checking off, making sure that, procedures are being followed and protocols and systems, every checks and balances are in place. And I feel like coming from the Caribbean island Jamaica, they call us developing country, and it's true, we really need to focus more in countries in the global south. I know it takes money and everything, but we have to focus more on improving those checklists, the quality standards, the audits. We can't just get into the habit of like nepotism, and because it's our friend or it's our sister, but we have to hold each other, whether they're our friend or our family, to higher standards of care delivery. And just remember that, look, if I'm the patient in that hospital bed, I want to know that I'm getting the best care, I'm getting the right medication, when I'm at my most vulnerable moment, needing an emergency surgery, some doctor, because they, didn't maintain their qualifications, is going to cut off the wrong part, cut off some limb when they should be stitching something up. So we have to really hold each other, especially our governments, the health systems, because again, health professionals and clinicians, sometimes they fail at their job because of the systems that are in place. The systems set them up to fail. So we have to, as advocates, health advocates, youth advocates, we have to say, look, you need to strengthen our healthcare professionals and our other professionals, or teachers, or pharmacists, or radiologists, or techs, or physician assistants, strengthen them, or doctors, so that they can provide the best quality care and services to us. Yes? Musa says, develop and facilities and innovation, research, collaboration, yes, between low and middle income and high income countries to fight against chronic diseases. Yes, I totally agree. Love that contribution, Musa. That's just some fire there. Thank you. Thank you so much for sharing that. Somebody else in the chat says, let's see, in the chat, good presentation. Thank you, Bayai Sakau from Gambia. By the way, but the way you are, it isn't like that. Forgive my pronunciation, okay? I'm sorry, yes. The the pronunciation might definitely be different. I acknowledge that. All right, great, great. So we are coming up to our next session. Our next session is at 16:55 UTC. Our moderator is Mr. Kim Albert. So 16:55 UTC, which means we have like seven minutes. Yeah, we have 7 minutes for our next session. 17, yeah, 16. 16:55. 16:55. 55. All right, great. Is Precious Ijiba on the call? We can start getting ready for our next session. Let me hop over to the chat and see. And yes, we can get ready for our next session. But great engagement, everyone. Keep up the great work. Yes, yes. Benjamin from Nigeria. Yes, yes. Thank you, thank you. I look forward to collaborating with you as well. Shout out to the Nigerians in the house. Woot, woot. Fostering unity among nations to address complex health issues, drive innovation, and ensure better health services. Thank you, thank you. Please, can you create a channel that teaches those things? Oh, of course, yes, certainly. It's different. That's why I cannot miss your voice at all. Oh, wow. Okay, thank you. Well, I hope you're understanding me, right? I'm audible and you're able to understand, right? That's the most important thing about communication. I know because of, our geographic backgrounds, some of us we speak very fast and we have an accent. It might be a little bit more deeply tonated, but I think the most important part of communication is being able to be understood. Yes. So I hope you're understanding me. Yes. Even if my accent sounds different, give me some thumbs up, some emoji, some love, some fire, some, celebration if you're able to understand me. I hope you've been understanding me as clear as day and not as clear as mud these past 3 days. Ah. Okay, great. I see Precious Ijiba. All right, so at this time, I am going to invite our moderator. All right, thank you very much, Juliana. Thank you, Jonathan, for the love. Yes, yes. All right, so I have not been as clear as mud, right? All right, you've been understanding me. All right. I love that. I'm happy for that. Thank you very much. Thank you, Benjamin. All right, great. Yes, so you understood me. Good, because when we're communicating, yeah, communication is not just about being heard, it's about being understood. Thank you, Jibril. I see the love. I see the love. I feel the love, everyone. All right, so at this time, I'm going to invite our moderator for the next session, Mr. Kim Albert, and our presenter, keynote presenter for the next session, Miss Precious Ijiba. And I hope I have been pronouncing your name correctly, Precious. I love the name Precious, and do correct me on the pronunciation of your last name when you come on. I hope I've been saying it correctly. All right, Mr. Kim Albert, And Precious Ijiba, you can go ahead and take center stage at this time. And Kim. Mr. Kim Albert.
I see you, Precious.
Okay, great, great. Kim,
Okay.
I can hear you, but I can't see you.
You can hear me?
I can hear you, but I can't see you.
Oh, really? Then there's something, because I can see you, I can see Precious. Precious, can you see me?
No, I can, let me see. I can see Precious also. Turn on your video. Try turning. Oh, yes, I can see you now. There you go. All right.
Hey, I'm alive. All right. All right.
Yes.
So good afternoon, good morning, good evening once again. It's amazing that the conference is ending just like that, and we are in the 3rd day. Oh gosh, I'm going to miss you guys. So it's day 3 of the World Health Exhibition Conference 2024. And as I said earlier, like seriously, the conference is ending and I'm going to miss you so much. So I welcome you to session 12 of the World Health Exhibition Conference, day 3. I believe you all know me already, but let me introduce myself. My name is Kim Albert, and I'm honored to join you from Ghana as your moderator for this session. So it's been amazing. So if you are ready, as I am, please let me see you drop some emojis and some fire in the session as we are ending. We are ending on energy. So you can feel the energy. Let me see you drop something in the chat box. Let me see you drop something in the chat box as we wrap up the session. Yeah, I can see people dropping the fire. Yeah. Let me feel the energy, because we are coming with more energy. We are ending on energy. Okay, so quickly, let me see what we can do. So thank you for staying with us throughout the day. I know we have been stressing you out, but I can say Miss Victoria, Tech has been friendly today, and let's comment Tech for being friendly. Tech has been friendly. Tech has been friendly today, and let's comment Tech for being friendly today. So thanks to the guys who are at the Tech table helping us to have an amazing conference today. So we are truly, grateful for having you and your time up until this time. So we are in session 12, which we are going to have a great conversation. Our presenter, our first keynote presenter is ready. So in this session, we'll dive into a transformative topic on digital health tools for health delivery. Digital health tools for health delivery. That is what we are going to talk about, and I know you are going to enjoy the conversation, the presentation, and everything. And I know this is a dialogue, so please let's hear you from the chat box. If you can unmute yourself and talk, let us hear you. So a quick background. A digital revolution has transformed industries worldwide, and healthcare is not exception. Digital health tools such as telemedicine, electronic health records, mobile health applications, and artificial intelligence, that is AI, are reshaping how healthcare is delivered and accessed. These tools have proven particularly impactful in underserved regions where healthcare infrastructures are infrastructure and resources are often limited. By bridging the gap in access, improving efficiency, and enhancing patients' outcome, digital health technologies hold immense potential to address patient health care challenges. So, without much ado, please help me welcome Ms. Precious Ijiba to give us our first presentation for the day. Precious, please, the platform is for you. You are on mute, please. Can you unmute yourself? Okay.
Okay.
Yay.
Thank you very much. Thank you very much. It's really an honor to be back here on the 3rd day. Hello, everyone. So I was here on the first day, the second day, and the third day as well. So for those of you who were with us earlier, I had the privilege of moderating the panel on strengthening health systems for a resilient future on day one. And yesterday, day two, I shared a recap of the insightful sessions yesterday. So today, I'm here to slightly in a slightly different capacity as your keynote speaker, and I couldn't be more excited. So I'm going to go ahead and share my screen. Kindly bear with me. Hold on, please. Can you see my screen?
Yes.
Yes, we can.
Yeah.
Okay.
Delegates, if you can see her screen, just show some thumbs up, some celebration, some fire in the chat. Are you able to see the screen clearly? Anaclito, Onika, Toshi, Samira, you're seeing the screen? Amelia, thumbs up. Musa, yes. Okay, thank you.
Oh. Okay. Hold on, please. Okay, so today I'm here to talk about digital health tools for healthcare delivery. And this is a topic that reflects not only where the industry is headed, but also what's possible when we combine innovation with a deep commitment to improving lives. So before we commence, I'm going to let you have a quick insight into this video. Then we move ahead with the rest of the presentation. Please let me know if you can see the video and if you can hear me all right.
Yes, we can see you and we can hear the video as well.
Okay. All right.
Innovation through digital technologies is transforming our everyday lives and driving us into a new era of healthcare. Digital health means the use of technology to help health systems become more efficient, support health workers, and improve patient care. Fueled by innovation and rapid evolving technologies, digital health is an $86 billion global market today, and it offers great potential to make quality health services closer, easier, and better for all. Here are some examples of impact of digital health. Better linkages. Digital technologies can help to collect dynamic, real-world health data from many sources. It can link devices and places and bring this data together in real time. Interoperable information. Interoperability is the key to connecting different data sources to make medical records accessible to all points of care, or to help public health agencies
I think
or health providers to get outputs
there's a
impact.
comment that they can't see the video. So if you
Improved
can pause and
analysis.
work on it.
Sorry?
Comments are coming that they can't see the video. They can't see the screen. So I don't know what is wrong. A lot of
But you can
comments.
see it.
Yes, I can see it, but I don't know why they are not seeing it. Yes, Ms. Victoria, please, can you help us from the control room? What is happening? Because a lot of messages in the chat box that they can't see. A lot of people are not seeing, and I don't know. Myself, I can see, so I don't know what is happening. Are you the one? Okay,
What is going
so
on?
I
Is it
think
from my
I'm the
side?
one they are seeing on the screen, but not the video.
Oh,
It's only my face that they are seeing, but they can't see the video. So that is what I am. That is the feedback I am getting here. So what could be the problem?
I don't know.
Okay, so let me off my video and then
I think let me stop sharing my screen first.
okay.
Okay, it said
Okay.
your shared screen can be seen only by host and co-host.
Oh, okay. So Miss Victoria, if you can hear us, please can something be done? Tech is really coming back to us today. Please, we beg Tech. Tech cannot do this. Be you are mute, please.
Yeah, I know. Trying to make Precious a co-host. Let's see. I think it has to do with the focus mode feature. Which
Okay.
I didn't set it. I'm not quite sure what the take because the presenters are in focus mode. It's for the more tech savvy people. So that all right, let's see. Sharing options. All right, yeah. All right, I got it now. Yeah, go ahead, Precious. I changed the settings so shared screens can be seen by all participants. Go ahead. So it should work now. Go ahead. Share again.
Okay.
Thank you for coming to our aid.
Sure, you're welcome.
Mhm. Okay.
You can share your screen. Yeah,
Can you
there you
see
go.
it now?
All right,
Can you see my
thumbs up,
screen now?
everyone. Thumbs up, everyone. Yeah.
Yes, if
Yeah.
you can see now, please show some
Thumbs.
love that you are in. We are in. We are in.
Yeah.
All
Thumbs
right.
up.
So if you
Okay, can
can
you
see the
see it
screen
now?
now, okay. Let us
Good.
see. Okay.
Good.
Okay.
Okay.
Thank you so much
Okay,
for
good.
being with
Thank you.
us.
All right, yes,
Okay.
finally.
All right.
Matua says finally, Chuendo says finally. All right, good. We're back in business. Tech is not
All
taking
right.
us out today.
Tech is not taking today, and Tech will not take today. I tell Tech.
Go ahead. Thank you.
Okay, let me go ahead and play the video now.
Innovation through digital technology is transforming our everyday lives and driving us into a new era of healthcare. Digital health means the use of technology to help health systems become more efficient, support health workers, and improve patient care. Fueled by innovation and rapid evolving technologies, digital health is an $86 billion global market today, and it offers great potential to make quality health services closer, easier, and better for all. Here are some examples of impact of digital health. Better linkages. Digital technologies can help to collect dynamic, real-world health data from many sources. It can link devices and places and bring this data together in real time. Interoperable information. Interoperability is the key to connecting different data sources to make medical records accessible to all points of care, or to help public health agencies or health providers detect outbreaks more rapidly. Improved analysis. Artificial intelligence has opened up powerful avenues to improve diagnosis and assist health workers in evidence-based decision-making. Improved access. Healthcare is no longer confined to your doctor's office. Telecommunications and visual technologies are helping bridge gaps and enable health service delivery in hard-to-reach areas to help achieve health for all. New tools. From simple technologies such as e-learning for health training and use of biometrics in disease tracking, to medical robots filling gaps in health workforce, digital technologies offer new tools to help meet the health needs of today and tackle health challenges of tomorrow. Alongside the unprecedented use of digital technologies for health, innovative approaches to their adoption are also needed so that patients, providers, and governments everywhere can benefit fully. The next era of healthcare is beginning. How can we harness digital health to promote and protect the health of all people?
Okay. So, from the video now, it's clear that these tools are really reshaping the how we access healthcare. But then it also begs the obvious question: why do we need it in the first place? So, why digital health? Let's consider this hard truth. So, according to World Health Organization, more than half of the population still lacks access to essential healthcare services, and that is nearly 4 billion people in the world. And in the underserved regions, the challenges are particularly their limited infrastructure, service inefficiencies, and a lack of tools to empower patients. So digital health tools are not just an upgrade, they are a necessity. They help us address these gaps by making healthcare more accessible, equitable and effective. But how exactly do we achieve this? So that brings me to my next slide, exploring these tools. So digital health tools like telemedicine, as you can see here, mobile health apps, electronic health records or EMRs, AI are actually revolutionizing healthcare. For instance, now you know that telemedicine brings consultations to patients in remote areas without the need for travel, and mobile health empowers patients to monitor their health metrics. With AI now, diagnostics are made easier, helping clinicians make faster and more accurate decisions. But then the impact is most profound in underserved regions. And these tools actually streamline decision making and also reduce cost. But most importantly, they save lives. And now, this would actually bring me to some of the projects which I've worked on, and I think I'm proud of these ones. So this is a case study, medical equipment failure prediction. One of the potential to empower patients with chronic diseases. Just imagine, I want you to think of like this scenario, detecting problems even before they occur. That is what this equipment is, or that is what this project is all about. So now, predicting medical equipment failures, I used time series analysis to build a model where, because you know the medical equipment is the backbone of healthcare delivery, but failures can actually cause delays, misdiagnosis, or even worse, loss of lives. So with this project, I leveraged predictive analytics to identify potential issues before they happened, ensuring that equipment stays functional when it's most needed. And then this reduces downtime, saves costs, and most importantly, saves lives, both of which I think is very crucial when it comes to digital health. Now, another project here is the diabetes data visualizer. In this aspect, we know that managing diabetes is challenging, especially without access to tools that simplify healthcare. Now, this project addresses this challenge by providing patients with visual insights into their blood sugar trends and enabling them to make informed decisions. It is not yet deployed though, but that is what I'm actually working towards. But the potential is actually undeniable. Imagine patients in understaffed regions using this tool to better their health, reducing complications, gaining insights, personalized insights, and improving their outcomes. So that takes me to this slide. I think, hold on a bit, please. Can you still see my slides?
Yes.
Okay.
Yes, yes.
Okay. Challenges in implementing digital health tools. We've seen the advantages, we've seen the uses, and we've seen the tools actually involved in making lives better and making lives easier for patients. But then there is this obvious problem we have, and which is challenges in implementing these health tools. When it comes to this, the most important one is infrastructure gaps, resistance with change, privacy concerns, ethical issues, lack of expertise, and interoperability issues. And all these things poses significant hurdles. And addressing these issues require collective actions. So governments must invest in infrastructure. And I would say organizations also need to prioritize training. Like we said in the panel discussion on the first day, training of healthcare professionals, that is something that is very, very essential. Collaborative policies must ensure data security because it's a tall order, but not impossible actually. So the key call to actions now, for everyone here, driving innovation for global health means investing in scalable and impactful solutions, empowering young innovators to bring fresh ideas, collaborating across sectors to ensure no one is left behind. And together we can turn these challenges into opportunities and truly revolutionize healthcare. So finally, I'm going to say that scaling digital innovation is about sustainability. We must ensure that these tools are affordable, adaptable, and designed, for long-term purposes. And I think from my own work and to the solutions that we've seen throughout this conference, it is clear that we are on the right track. So we should actually take everything that we've actually learned from this home and drive change in this industry. So thank you for your attention, and let's continue to innovate, collaborate, and build a healthier healthcare system. Thank you.
All right. Thank you too for your presentation. We are going to collaborate and we are going to innovate to help the healthcare system in the near future. Thank you so much, Blessing, for that amazing presentation. So, Blessing, don't go, don't leave me. We are in this together. Hey, Precious. Why Blessing now? Blessing, don't curse me. Forgive me. I beg. So, Precious, don't leave me. I have some couple of questions for you. I hope you are there.
Yeah.
All right. So delegates, please, you can start dropping your comments and your questions and some fire emoji dropping. Please drop something. We are in this together, okay? I beg you. Let us feel the energy. Today is the last day. From today, you are not seeing us again. So let us, enjoy the section and the conference as much as we can. So, Precious, my first question is, what are the most promising digital health tools currently transforming the healthcare or healthcare delivery? What are the most promising ones that you can pinpoint and say, these ones are the ones that are currently transforming and helping healthcare delivery? Can you mention one or two?
Yes. mHealth apps, EHR. I think the most promising digital health tools actually like telemedicine, the mobile health apps, electronic health record,
Hey, Precious,
AI.
Precious, do you want to put your video on? It's off.
Oh, sorry.
We want to see your beautiful face, please.
Can you see me now? I didn't even know I.
Okay, yes.
Yes, okay. So I mentioned telemedicine. Imagine having to consult with your healthcare provider from the comfort of your home, not having to travel places or long distances just to get medical care. Then also look at what we talked about, medical health apps. For instance, the case study I mentioned the diabetes data visualizer, where patients can actually monitor their blood sugar levels. There are so many other apps like this, even wearable technologies that provides personalized insights into patients' health. So tools like these are actually really promising when it comes to digital technology, and they are actually helping patients, improve their lives and manage their health better.
Okay. All right. Thank you so much for that answer. I can attest to that when it comes to, and one of the tech system that is really helping this, system is Apple. Apple is really doing well when it comes to these things. They have inculcated some of these apps in their mobile phones and their watches that even when you are walking, it can tell you the number of steps and everything, your heartbeat and everything that has to do with your daily routine that is. So I think Apple is helping with that particular aspect. So thank you so much. My second question is, what measurable outcomes have been achieved through digital health tools and in the underserved regions? Because you are from Africa, and when it comes to Africa, these things are very, we are deprived of these things. So what are some of the outcomes that you think the underserved regions have been benefit from?
I would say improved access to care. There are so many programs. I think there is one Indian telemedicine platform that's facilitated over 100 million consultations, that connects rural patients with urban specialists. And I would also say reduction in cost. These mobile health apps payment, that ensures financial inclusion for health services. And the obvious one also, enhanced health outcomes. This one cannot be overemphasized because you can agree with me that okay, let me still use wearable devices as an example. When patients actually get insights into their health, right, they tend to manage their health better. For instance, if your device tells you that your blood sugar is going high, or maybe tells you to cut down on carbs and things like that, obviously you're going to want to cut down or reduce your carb intakes, or probably exercise more and all that. So by doing this, these tools are actually empowering you to to make decisions to better manage your health, thereby leading to improved health and enhanced healthcare system.
All right.
Yeah.
Thank you so much. And before we go to the chat box, there are some questions in the chat box, but let me take Miss Victoria. I can see her hand up. Your hand is down again. Your hand was up, ma. Okay. So that might be a mistake. So there's a question in the chat box. The person is saying, my question is, how can you know that your blood sugar level is low or high? Musa, that is a question from Musa. So how would you know that your blood sugar is low or high?
Okay, so now that depends on when you're measuring. We have fasting blood sugar, and we also have random blood sugar levels. I think the fasting one is that if you've not eaten for the day, and then the random one is if you've eaten. So depending on your unit of measurement as well. I think normal blood sugar level for fasting is around 70 to 100. Is the units, I think, micromole or something.
Milligram per deciliter.
Yes,
mg.
yes.
Yeah.
Yeah. So that is the normal one. And then I think anything that is above 100 for fasting should be an indication that it's a bit high. And anything above 140, I think should be considered diabetic. But if it is for random, up to 140 is still within the normal range because you've eaten for the day, right? But even for random, above 180 is considered high. Even though like some studies might actually have different opinions on this. I've seen studies that actually said up to 200. I've seen some that said 180. So it depends, but just know that just within that range of 70 to 140. And then if you also go below 70, that can also be bad as well. That means you're having low blood sugar, which is still not good. So you still need to, maintain the balance. Yeah.
Okay. Precious, before you Ma, do you want to add something?
Yes, there's a question in the chat here from Amelia Frederick.
Okay.
She says, how can we make digital health accessible, these wearable devices affordable to people living in low-income countries?
That is a good question. I think in this case, the government has a role to play there based on funding, incentives, and all that. And yeah, I think that's the major thing, because if you look at underserved regions like Africa, most of these healthcare tools are not really accessible to them, and I think that is where the government comes in, because I think that is where the government comes in, based on funding and promoting public-private partnerships.
Okay. All right. Thank you so much. Your last but one question. This is my personal question. How do you see the influence and impact of AI and technology on health delivery system or on healthcare delivery in the next decade? How do you see the impact? What is the impact going to be in the next decade?
To be honest, it's actually what we have seen now. I think is just the beginning.
Okay.
There is more to come. There is something about predictive analytics. What I mentioned earlier regarding the equipment failure prediction model. Just what I'm seeing, the role of AI data, predictive analytics in the future is more about prevention than acting on the cause, in the sense that I'm seeing AI predicting outbreaks even before they occur.
Okay.
And when that happens, the government, the world, they will be able to make decisions, informed decisions, to actually provide measures to combat the effects of the outbreak or of the disease. So even if they are not able to prevent it from happening, they are going to be able to have measures in place to handle it effectively. So this is
Yeah.
where I'm actually seeing AI in the future.
Okay.
I think I did a research sometime where they said predictive analytics, AI, is being adopted in many industries now, but slowly transitioning to healthcare. And in the future, I'm certain that it is going to be something that the healthcare industry will really invest in. And when this happens, I see it really revolutionizing the healthcare industry for the better.
All right. Thank you so much. I had a follow-up question, but rest. There's a question here. The person is saying that if a patient's blood sugar is high, this one should be for a doctor. Are you a doctor?
Yeah, I was going to answer that one.
I
I'll
can
take
take
it.
a go.
I can take it. I can answer
Okay,
it.
okay. So
I was going to
you
answer
okay,
that
go
one.
ahead, let's go.
I saw it in the chat
Okay.
as well. So great question here from I believe is it Nelson Adapwa.
Yes,
Thank you,
so
Mr. Nelson, for your question. Yes, so Precious, she mentioned some aspects of it earlier in her answer, where if that blood sugar is above a certain level and it's consistently, because there are days when if you splurge, the holiday season coming up, and you really indulge, you're just on a seafood diet and you're eating every sweet, that every candy, every cake that you see, then you can have spikes in your blood sugar or your blood pressure because of your sodium, your salt, and your sugar intake. But if you go to the doctor, if you have a machine and you're checking it by yourself, and every reading consistently, especially consecutive days, it's high, then you do need to go in and be properly checked out and possibly start. Most times when it comes on to blood sugar control, it can be diet. Diet is a great way. Diet controlled diabetes is usually like, we're able to control it when we modify our diet, and also through exercise, activity, keeping physically active. Then the body, the metabolism rate will help to properly regulate the blood sugar. But if it is that you're eating, you're exercising, you're monitoring your weight gain, and every time you check that blood sugar level or blood pressure, because they tend to go hand in hand at times, then you would need more aggressive intervention, possibly starting some medication. Blood sugar control, also, you want to make sure that you stay on top of it, because it's one of the silent killers, where it causes severe organ damage if we don't control these blood sugar levels. So it can damage the eyes, what we call retinopathy. It can damage your kidneys, a nephropathy. It can damage the brain, neuropathy. So diabetes is not one of those conditions, nor high blood pressure, that you want to play with, because these are silent killers. So great question.
okay. So there's one here that says that if a patient's blood sugar is high, is that one that you have answered? Okay, let me ask. So if a patient had a blood sugar is high and had a cut or care on his leg, how can it be treated within shortest possible time?
Okay, again, seeking medical intervention. Now, one of the things with diabetes, some persons have that genetic predisposition. So if you know that your father, your grandmother, your grandfather, you have a family history of, somebody, especially immediate blood relatives, a parent has diabetes, and then you realize that you start having, high numbers, then you know that your likelihood, the genes are already there, your predisposition genetically, the research has shown that genetic predisposition is one of the highest factors or indicators, as you know, Precious was mentioning, that some of these apps can indicate the predictability that, you know, this is going to happen. Then that is one of the things. Genetic predisposition suggests that you already are, you know, you have a ticket already to developing this condition. So if you get a cut that is hard to heal, yes, some Musa asks, what are the signs and symptoms? So the main signs and symptoms of, say, diabetes, that would be an indication. You get a cut and it's just taking very long to heal. You know, it turns into this ulcer. You're trying home remedies, and you have to be so careful about that, because once that cut gets infected, then you can actually lose your leg, you know, the limb. You know, that's one of the main complications of people with diabetes, and especially when it blows out of proportion and it's not properly treated, they end up having to amputate that limb because the blood supply is affected and the blood cells and the organ, the tissue dies, leading to a condition we call necrosis. You know, it turns black and it doesn't look good. A lot of things happen with it. And then the nerves are also affected, the innervation. That's what we call it neuropathy. So if you know that already you have a family member and you're already predisposed to diabetes, then make sure that you are, you know, going in for your checkups. Other signs of symptoms, like if frequent urination. So if you have to be getting up, you know, or urinating right throughout the day, then that could be a sign that your blood sugar level is high, because your kidneys are they're working really, really hard to try and get rid of that excess glucose and sugar in your blood. So, you know, frequent urination. If you also are very thirsty, you know, you're just drinking a lot of, you know, and it's not just because the time is hot, but even in the middle of the night, you're just so thirsty. You have to be getting up and you're drinking a lot of fluid. You just feel very thirsty. You know, that's a sign of diabetes. Another sign is being very hungry. So you've eaten a big breakfast, a big lunch, a big dinner, and then you're starving. You know, that could be a sign that your body is not regulating the sugar properly, and so you might have diabetes. So those are some of the signs. The three main signs are frequent urination, polyuria, excessive hunger, polyphagia, and excessive thirst, polydipsia. So those are medical terminologies. But three main signs: always hungry, always thirsty, and always urinating a lot. So Musa, that's the answer to your question there.
Thank you so much. We have some practitioners in the house. You can hear the terms. Yeah, yeah. So I think we'll move on to, is our next keynote speaker ready?
I was looking for that person as well, Matthews Mashanai. I have not seen him, so that means we do have time still. You know, Precious, you know, you're in the hot seat still. And the chat,
I just want to add to what you said.
Yes, okay. Yes, go ahead.
So I'm going to say that everything Victoria said is true. But to be honest, the best treatment for diabetes is to prevent it from even happening. Especially if you have a family history of the disease, it is best for you to actually take preventive measures from allowing it to occur in the first place. And how can you do this? By monitoring yourself, not only based on what you eat or exercise or healthy lifestyles, but these wearable devices we are talking about, these technologies, these inventions, they are there for you, and most of them you don't really even need to pay for it, because most of them are integrated into your mobile apps, and you just access it free of charge. So you need to constantly monitor it so that when it enters pre-diabetes, then you know that you're nearing there. Then you have to start watching yourself, and you have to start cutting it down to prevent it from escalating. Because if it escalates, then you might not be able to control it. So that's what I would say.
All right, thank you for that addition. I can see somebody's hand up. Where is the person? Okay, somebody's hand was up, but I think the person's hand is down again. So if you know you have a question, it's a dialogue. So please, you can raise up your hand. We will call you. Precious is here. She's going to help us. I mean, answer every blessing. Don't kill me. Okay. So before any question come, Precious, how can government healthcare providers and private sector collaborate to address these challenges that we are discussing here in terms of helping somebody with diabetes and all this, having access to digital tools that can help them in their health?
Okay, so in this case, like you said, collaboration is actually key. So government can provide funding and policy support. Private sectors can be like drive the innovation and the scalability, while healthcare providers can bring practical insights, to ensure that these tools meet real world needs. I think from one time I was doing a research, I saw, is it Rwanda's partnership with Zipline? I don't know if I think I remember it correctly. So I think the government worked with the private sector to deploy drones for medical deliveries, saving lives in remote areas. And so these are ways that they can partner together, and also partnership for training as well. Companies like Microsoft have collaborated with NGOs to train health workers on digital tools, ensuring effective adoption. So I think that these collaborations actually highlight the power of pulling resources and expertise together to overcome challenges. Yeah.
Okay. Thank you so much. I was having a question before we went to the discussion of the sugar level. My question is, do you think some AI or artificial intelligence can predict ahead of us? Because I don't want what happened in 2019 to happen again. That is COVID-19. Do you think some artificial intelligence can foretell or can tell us 10 years ahead? Because what can happen? Can something like that happen again, so that we know how to build resilience for that thing? Because we don't want it to happen again. So can there be any technological system that can predict and tell us that, okay, we foresee that in the next 10 years, something like that is coming. So we have to build our systems. Do you think there's something like that, and can something like that, okay?
Yes, that was actually what I mentioned about when you asked me the future of
Okay.
I think something, is it digital tools or AI in the next 10
Sure.
years or something. And I'm
Sure.
saying these tools are actually adopted in many industries already. Many industries are already utilizing predictive analytics, because what you just asked now is based on predictive analytics, trying to predict events before they even occur. And that is
Sure.
where data plays an important role, because what happens, it's not just all about using data to, look at trends and patterns and then provide insights into it. It goes beyond that, you understand. Training models, machine learning models to recognize certain patterns and all that. And yes, I really see this coming into healthcare and changing the industry for good. Yes, so my answer to your question is yes. I
All
think
right.
it is going to happen, and maybe sooner than we expect.
All right. Thank you, because we don't
I've
want it
heard
to
this
happen again
thing
ever.
that oh yes.
Okay, you're about to say something.
Okay, I said I've read somewhere that pandemics occur, is it like 100 in once in like 100 days? I don't know how correct that is, but I think I've seen something like that. And I think that they were able to come up with that based on patterns, histories,
Okay.
or these predictive analytics we are talking about as well.
Okay.
Yeah, but don't quote me on that for now.
Yeah,
I need to
well,
get that part
I'm
right.
not I'm not going there. Okay, thank you. I think
Mhm.
Nelson
yeah, Nelson has a question.
Nelson.
And
Okay.
and also we're gonna take Nelson's question in a minute. But just to add to what Precious was saying, yeah, the
Okay.
predictive analysis, I know here in the USA, they are doing a lot of like testing where like sewage and the water quality. So when people pass their waste, they test to see different things that are in like the wastewater. And so
Okay.
that is an indicator for, the epidemiologists, the people who are studying disease trends. And it gives an indication of like, okay, it seems like a lot of the people in this region, these are, the eating habits, or, these are the waste pattern that we're seeing. So it can indicate that, they've been doing, looking at a lot of the waste. That's what I've seen and heard some of the research saying that they've been, trying to make predictions about future disease outbreak based on, some of the waste and how, the trends that people in various geographic regions, some of the things, their eating patterns, their waste patterns, that sort of thing. But yeah, let's take Nelson's question, and great
Okay.
responses, Precious. Nelson Adapwa, you did have
Nelson,
your
yeah.
yeah, we still have some time because I don't
Yes.
see the second presenter. Matthews Mashonai is not on, and so we still have time for this session.
If
So
Nelson is around, please, you can unmute yourself and then ask your question. So guys, please, you can keep your comments coming in the chat box. Let us hear you. We are in
yeah.
this together, so let us finish with energy. The energy is still there. Yeah. So somebody is asking attendance form. I have been seeing this for a couple of times.
Hello.
Yes, go ahead,
Yes,
Nelson.
Nelson, the floor is for you.
All right. Good evening, Victoria. Good evening, the presenters. My name is Nelson. I'm from Nigeria. My question is, there was a time we had, my dad had the issue of diabetes for almost 8 years. Hello.
Yes, we can hear you.
We can hear you.
You're audible, Nelson. All right, he seems to be having some
Yeah.
communication.
Tech is
Yeah, but
tech is taking
tech is taking him out.
him. Tech is
All right.
taking him.
All right, I'll answer the question though, because he also posted it in the chat group. So
Yes.
thank you for, he's a very active participant in the chat. So thank you for that. So yeah, so he did say that his dad, apparently his dad has diabetes. And so he had a wound, as we referred, one of the signs is like if you get a cut somewhere and it just takes forever to heal, because that's what diabetes does. It affects the tissue, it affects the nerves, it affects the body's ability to heal properly. So, but he said that they did use something on it for, and then the wound eventually heals. But his concern is if there are any long-term side effects. Now, if the dad, remember we said that diabetes diagnosis, yes, it's great we try to prevent it, but the reality is some of these diseases will still occur. They're chronic diseases. They've been around before our time, and they're going to continue because that's just the way illnesses are. So we can try everything to do. There have been people who have never smoked a cigarette in a day, and yet they end up coming down with lung cancer because their family, there's some predisposition somewhere to cancer. So not everything we can prevent, lovely people. So the great thing about that though is once we recognize that something is off, then we have to treat it. The next thing is managing it properly so that we can still be functional and productive in our communities, on our jobs, and still the condition does not affect our livelihood. So for Nelson's question about long-term effects is to make sure that he's keeping up with his doctor's appointments. If he's on medication, make sure he's taking those medications and, you know, doing the follow-up to see how his body is responding to the medications. And this is general response for anyone, as I said, with a chronic illness, right? We try to prevent it, but now you do have it, or a relative of yours does have it, then let us try to stay functional and manage it properly. You know, people have still been able to live years after a diagnosis with anything of the sort, which even HIV, you know, whatever the disease condition is, people have lived functional and active, healthy lives still for years after, 10 years, 20 years, 30 years after a chronic diagnosis because of proper management. So don't think that just because you got a diagnosis, it's now a death sentence and you're gonna get into depression and stress over it, because stress will kill you faster than the actual diagnosis of the disease. Yes? So make sure we're managing the condition properly. So for Nelson, that's the answer. Make sure that you're staying on top of your dad's medical visit. He's eating properly. There are certain foods he has to avoid, those processed sweet. If he has a sweet tooth, no, he can't sit down and eat 12 mangoes and say, oh, I'm going to take my diabetes medication. He has to adjust his diet. And he has to exercise, you know, do something, stay active, and he has to watch his weight because he has the diagnosis now. We've passed the stage of prevention. All right, everyone. So that's the response to that question.
Okay.
Great question.
Yeah.
Thank you.
So, Nelson, thank you. I hope your question has been answered. So guys, thank you so much for staying with us throughout the day up until this time. We truly appreciate and value your time and your presence. Even in section 12. So if you have really enjoyed section 12, I have a last question for Precious. But before we leave with Precious, if you are enjoying the session, let me see you type in the comment section, S12. Type in the section S12, 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 and let me give Precious the last question so that we wrap up with this session. So let me see you type in there. I want to read. Yes, I see somebody type S12. Okay, Jonathan, thank you for typing S12. All right. Who is the next S12? I'm waiting. Okay, I see Nelson S12. Thank you, Nelson. And then who again? I'm waiting for you, the person typing. Okay, I see Mohammed S12. Okay, who again? S12, Samson. All right. Okay, so keep it flowing, keep it flowing. Thank you so much. We are wrapping up with this session in the next 10 minutes. S12 is flowing. Thank you, guys. I love you so much. Precious. They are enjoying you. You can see the way the S12 is free. It means they are enjoying you. So you can sit up for us as we are coming. So Precious, your last question is what are some primary challenges to the implementation of digital health and technologies, particularly in resource-constrained environments, especially, let me be biased, let me be a bit kind of biased here, especially when you come to Africa, because Africa, let me use Africa. Africa is the only continent I can use. So when it comes to Africa, what are some of the challenges you think implementing this, tech is bringing?
Yes, so I think I mentioned some of them during my presentation as well, but one key one, like I said before, is gaps in infrastructure. You know, many underserved regions lack reliable electricity or even internet, you know, and this actually hinders deployment of digital tools. Another thing I can mention there is resistance to change. You know, healthcare providers might actually be hesitant to adopt new technologies, maybe due to lack of training, or they might even fear maybe redundancy or something like that. I was having a conversation with a professor one time, and she's into robotics for healthcare delivery. And one of the things she mentioned, because I also asked her this question, she mentioned something about like ethical concerns. you know, biasness. You know, most of these digital tools, actually, especially if they are not well considered for, as in to be, how do I how I don't I'm trying to find a better way to put it. If it might actually be designed for maybe like a particular region, subconsciously, it's not that, because these things actually comes from like the training models. If you don't use enough training data to train your models for maybe like certain tools, it might actually be biased in providing insights to a particular set of people, or maybe to actually meet the needs of a particular set of people. So this is
Okay.
where like ethical concerns comes in, right? And I think to overcome this, developers actually need to like do their homework when it comes to like sourcing data, carrying out pilot studies to ensure that it meets the needs of the people and all that. Privacy concerns as well. So, say for instance, now robotics or in healthcare, right? They have data of patients, and there may be issues of data breaches. You understand? So these are some of the challenges I would say that that affects the implementation of these digital health tools.
Okay. All right. Thank you so much. It's been amazing having you. You are looking so glorious wherever you are. Thank you so much for joining us. You've been amazing this evening, and I hope our audience, they've really, enjoyed your presentation and your answers and everything. So, Precious, thank you so much. So our time is getting closer and closer. Madam, when am I closing this session? I think I have less than 4 minutes.
Yeah, we're wrapping up. There's one question in the chat that I wanna grab. Daberici, I
Okay.
believe last name is very, very Estoscialidocious, so I'm not gonna try to pronounce it. But Daberici is asking about these apps. What are the reliability rates? So, Madam Precious, before you go, like personally, I've heard that the apps, I've seen some of them, being used by people with diabetes, and they're very, very reliable. So, what has been your experience? Can you answer that question for Dabarici? Thank you.
So she's asking about sorry, I don't know if it's a he
He
or a
or
she.
she. I don't know if it's a
Yeah.
he or she, but the person is
Okay.
just asking, like these apps that you speak about, how reliable they like they're saying, do they really work? So even some of them, the smart watches that record our blood pressure and our heart rate, I feel like they're pretty reliable. They tell us the number of steps that we've gotten in for the day. They tell us how long we're sleeping. Some of them, they can record if you're having sleep apnea. So the research, the data shows that they're pretty reliable, right, Precious?
Yes, so they are reliable. But what I just mentioned earlier, this actually depends, because um most of them might not be 100% reliable. Of course, they're not even use 100%, maybe like 99.9%. And it's all from the developers, their training data, the models, if they were able to use enough data to train their models, and the diversity of the data, is it just from a particular region? Did you collect this data from like different regions to incorporate different lifestyles? Africans, you know that you cannot compare the lifestyle and health of Africans to maybe Asians or Europeans and all that. So if the app is actually designed incorporating all these sets into it, and then you train the model, then you might have like a 99% accuracy of the app's prediction. But then when you, because you know the diabetes data visualizer app I spoke about, that's my own project. When I first did it, I just used a very small data set to just see how it works. And you can see that because the data was just like from just a specific region, it predicts well for that particular region. But then when I started exploring, getting data sets from diverse regions, I actually noticed that it gave better predictions when it comes to like different people from different regions and different continents. So that is what I would say. But anyone you see that has been deployed and used by maybe the NHS in the UK, or like maybe university teaching hospitals, or maybe like big, they must have undergone pilot testing stages, and they would have confirmed that yes, it actually accurately predicts the disease or whatever you're using it for. Yeah, so that's my answer to the question.
Okay, so thank you so much. I can see some question here. Somebody's asking, where is it? My time has elapsed, but let me see. I can say that they are about 70%, if not 80, reliable from where I am sitting, because we use apps for some of our healthcare management. Yeah, so somebody is attesting that they are 70 to 80% reliable. All right, so thank you so much. So my time has elapsed. So thank you so much, Precious, for joining us in session 12 of the Day 3 of the World Health Exhibition and Conference 2024. It's amazing having you. Thank you for your presentation. Thank you for your answers and everything. So this is where we bring our session to a close. So my name is Kim Albert from Ghana. It's a pleasure being here, joining you. Finally, like seriously, the conference is ending like that. It's been a virtual conference, but yeah, I've enjoyed, I've really had fun. I have really networked, I have really learned something. And I believe that the delegates, they have also learned something. So Ms. Victoria, thank you so much for having me. It's a pleasure being here. My name is Kim Albert. You can connect with me on LinkedIn and Facebook. Thank you so much.
Thank you. Thank you to such great moderator, Mr. Albert. You were vim, vigor, and vitality. Thank you so much. And Precious Ijiba, I believe I did get your name right. Yay. Yeah. Thank you so much. Great presentation. And we learned so much, and your responses were on point. So thank you so much for being a part. You were a great moderator too, one of the days. And then thank you for giving us the keynote today. We really appreciate your presentation, Madam Precious. Thank you.
No worries, right. Thank you. I'm so happy. I don't even want it to end.
I know, right? They say all good things must come to an end. So we're on the final hour now. We're wrapping up.
I don't want it to end as well.
we cannot live in virtual reality, people. We have to go back to, and continue these. That's why we keep the networks, keep the connections, keep the collaborations going, outside after this conference ends. But yes, I'm gonna miss you all too, but yes, we'll continue in real life. We have to get back to the real world. All right, great. So a number of people just keep asking about attendance form, and this is something that we have constantly addressed in the delegates chat group, and even here on the call we've been saying, look, everyone, you are registered. You had to put in your full name and your email to be able to come into this Zoom presentation. So your attendance is registered, okay? And post-conference, I believe everyone will get like a survey, maybe like, feedback on the conference, like how we can make it better, things like that. If you respond and answer the survey, then, we have your correct email, you will get that certificate of participation. So stop asking for attendance form, please, because your attendance is automatically registered. So yes, Mohammed Yusuf, you've been asking that question all 3 days now. You will get a certificate of attendance. We see that you've been present since day one, so don't worry. Your certificate is good, okay? We good. I love it. Jonathan Osigbo, all right, I see your hand. Let me go ahead and take your question while we get ready for the next session. All right, Jonathan, go ahead with your question, sir.
Okay, I just want to say thank you for this great section from Thursday to this day. I joined only today because of the enormous work I have on my location where I'm working. But I want to say thank you for today's presentation. I asked a question concerning how the health team that is in Africa can help to collaborate in assisting in the provision of telehealth or telemedicine kits in the rural areas where the government and the organizations like companies will not be able to assist. Again, I also ask how that this conference can be replicated frequently, not just once in a while, because it makes sense to help the health professionals build up fastly and then help in also reducing the health challenges that we have in our continent, especially Africa. Thank you, Uki. That's my mother's name, and I love that name so much. And thank you for all presenters. Precious, you are amazing. And every other person that has done presentation today. Thank you very much.
Okay. Thank you so much, Jonathan Osigbo. Where are you from, Jonathan?
Oh, from Nigeria here.
Nigeria. I told you, the Nigerians outnumber us today. But thank you, Jonathan from Nigeria. All right. Thank you so much for those great remarks, those feedback. We really appreciate you being here with us. And truly, we are grateful that we could collaborate and network like in this fashion to be able to, share the information, to empower and to educate everyone as youth advocates. So thank you so much for those great comments, Jonathan. And as to your comment about having these conversations frequently, well, it takes so much, there's so much that goes behind the scenes to put on a conference of this nature. So I don't know that we can have it every month or even every 3 months, but certainly with the next conference for next year, we are wanting to make it hybrid. We're going to be looking at a central venue, London, UK, or even the USA, or we can go to Jamaica. We could bring it to Jamaica, yes? And where everyone can be able to travel to and participate in person. So we definitely are going to make the next conference. This one we had to be more virtual, but our next conference for sure will be hybrid. And so it's a lot of planning that goes into it. So it cannot be every month even, but thank you so much for those kind comments. And as you said, your question about collaborating, for sure, when we leave today, we shouldn't just end the conversation here. We have to continue the discussions and the collaboration. So thank you so much for those kind comments. At this time, we're going into the next session. We are going to invite Saba. Saba, I don't want to spoil your first name, sir. So let's invite you to be a co-host at the virtual platform here. Let's make Saba co-host. Saba is our moderator for the next session number 13. We're winding it down, people. We're winding it down. We got to go home. TGIF. It's Friday. Thank God it's Friday. Yes, we got to wind it down, okay? So Saba is our or moderator for this next session. And we do have our keynote. Miss Natasha, no money there. The sign you're seeing, the symbol in the chat is S12. It's not a money sign. Look, the chat, the comment section is just cracking me up. Somebody's saying, what is this S money 12 about? It's our moderator, the previous moderator, Kim, asked everyone if they were enjoying the session to drop S12, session 12 in the chat. So nobody's collecting any monies around here, right? No offering collection. All right. But I love how you all engaging and just cracking me up in the chat there. So let's have Saba, or next moderator. Yes. Somebody's like, we've been here 3 days now. Let's collect offering. Get it. All right, love it. Okay, let's get Saba. Over to you, Sir Saba, for this final session. And I know our next presenter, we had one of the keynote speakers for this session present already. So Mr. Wisse is gonna be our next presenter here, yes, and